Hello, my name is Barbara Burke, and this is a PowerPoint presentation on the outpatient diuresis of heart failure patients. We will begin with a basic understanding of heart failure. Heart failure is a chronic, progressive condition that occurs when the heart muscle is weakened or has become stiff and cannot pump enough blood to meet the body's needs for blood and oxygen. The left ventricle of the heart supplies the pumping power for the heart to move blood to the rest of the body. In left-sided or left ventricle failure, the heart has to work harder to pump the same amount of blood. Fluid can build up in the lungs and cause shortness of breath. The right ventricle pumps blood back out of the heart into the lungs to be replenished with oxygen. In right-sided or right ventricle failure, pumping power is lost and blood backs up in the body's veins, causing swelling in the legs, ankles, and abdomen. Initially, the heart tries to compensate by enlarging, developing more muscle mass, pumping faster, constricting blood vessels, and/or diverting blood away from less important organs. Risk factors for heart failure include hypertension, diabetes, coronary heart disease, and obesity. Heart failure is a burden to the healthcare system. Heart failure is very prevalent. 5.8 million patients in the United States have been diagnosed with heart failure. This prevalence is due to our aging population, the improved management of heart disease, and the failure to adequately treat risk factors. In fact, in the U.S., heart failure is the most common cause of hospitalization in people over the age of 65 years. In 30% of patients, readmission occurs within the first 60 to 90 days after discharge. Managing heart failure must include educating patients to recognize symptoms related to decompensated heart failure. Most patients who present to hospitals with acute heart failure are admitted. Some of the causes of readmission are smoking, non-compliance with medication or diet, delay in treatment, lack of family support, and depressive symptoms. One of the challenges of controlling symptoms of heart failure is maintaining proper fluid balance. Lifestyle changes that can improve the symptoms of heart failure are exercise, a low-sodium diet, stress management, maintaining a healthy weight, and not smoking. Heart failure patients must be vigilant for signs of hypervolemia, such as weight gain, shortness of breath, fatigue, weakness, or lethargy due to heart failure-induced circulation-related abnormalities in skeletal muscles, edema, paroxysmal nocturnal dyspnea, which is an attack of shortness of breath or cough during the night, and depressive symptoms. It's not known why there is a high prevalence of depressive symptoms in heart failure patients, but they are associated with adverse outcomes. Outpatient IV diuretic therapy has the potential to avoid the need for emergency department visits and potential hospitalizations in select patients with decompensated heart failure. The goals of diuresis are to make the patient feel better, establish hemodynamic stability, relieve congestion, and improve the patient's volume status. Changing the way of thinking to outpatient diuresis is challenging. The dynamics of change and innovation are best understood and advanced when several things are known. We want to know who will be affected by the change. Patients will be affected in the potential for avoiding hospitalization. Urgent care providers and nurses are affected. Cardiologists are affected because they have an alternative way of stabilizing these patients. The local hospital emergency department and cardiology inpatient units are affected. Every member of the team must be aware of personal change abilities as these changes are established. How do we change? We collaborate to enhance the potential for success and the sustainability of change. We embrace vulnerability and we manage risk. The criteria that a patient must meet to be eligible for outpatient diuresis are: the patient must be under the care of a local cardiologist who calls report to the urgent care center. Patient reports fluid overload of more than 3 kilograms from baseline, breathlessness, and/or fatigue. The patient must have adequate venous access. Patient must be able to ambulate to the restroom. Patient must be willing to follow up with the cardiologist and/or have labs drawn the following day. EMS will transfer to the emergency department any patient who experiences an adverse reaction during the infusion. Stat labs must be drawn on every patient prior to the infusion, and vital signs must be monitored continuously. There are lab values and vital signs that will exclude a patient from receiving outpatient diuresis. Several studies have indicated that this change can be done safely. A 2016 study stated that a short course of IV diuretic for volume management in heart failure patients is safe. This strategy may provide an alternative to hospitalization for the management of selected heart failure patients. Outpatient IV diuretic therapy may have cost avoidance benefits. And there is a heart failure team at Northern General Hospital in the UK with a service run by nurses for patients in the community who need IV Lasix due to failing to respond to their oral diuretics. This program has been successful at keeping heart failure patients out of the hospital. Nurses who are facilitating change are called upon to be leaders. Some of the things that nurses must do in order to lead successfully are to be clear about expectations, set a specific timetable for completing education, avoid judgments about others engaged in the change, encourage communication that addresses concerns, and delegate tasks based on skills of the team members. In conclusion, the management of heart failure that successfully prevents readmission to the hospital improves patient outcomes. Based on evidence in the literature, outpatient diuresis of certain patients is an appropriate treatment for symptoms of heart failure. Nurse leadership will inspire teamwork that can facilitate this kind of treatment in the ambulatory care setting.